I wanted to ask about some of the effects after you've had coronavirus, whether you got not diagnosed with it or you self-quarantined because you feel like you had the symptoms. And I've heard that some people are going to have permanent issues, perhaps with their lungs or other permanent issues. Has that been something that you've been seeing where even after all the symptoms are gone, they still have some permanent lung issues and things like that?
Okay, so it really, that's a great question, but there are a couple of different types of what we call syndromes associated with coronavirus. The majority of people, and there's probably, I would say, we don't know the exact number, but somewhere around 25 to more % of people who actually get infected and have zero symptoms. They don't even know they're infected unless they happen to get tested. There doesn't appear to be any issues with them. They clear it. Others get infected, and the majority of them do very well. They get fever, they get chills, they get aches, they feel like a really bad viral syndrome. They don't really need any type of medical intervention of any note. When those people get better, they usually feel not great for a few weeks after. It's almost like a post-viral weakness and fatigue. They generally get over that and do well. We don't think there's going to be any permanent damage. About 15% of the people who really get in trouble, most of them are either the elderly or those who have underlying conditions, heart disease, hypertension, diabetes, asthma, obesity. When they get sick, particularly those that have to get put in intensive care, we don't know yet because we haven't followed it long enough. We've only been involved in this for a couple of months, 2-3 months, is that those people very well may have some long range difficulties as anyone who required intensive care. But most of the people recover and do well with some, kind of a few weeks of fatigue after that.
All right. Dr. Fauci, let me ask you, I want to ask you about a couple of other doctors, Dr. Oz and Dr. Phil. They're both feeling social media's wrath this morning. Dr. Phil, because he said we don't shut the country down for automobile deaths or cigarette deaths. And Dr. Oz for saying that opening schools may only cost us 2 to 3% in terms of total mortality. What do you think of those comments as a doctor?
Well, I think that they're entitled to their opinion. I disagree with them. The issue is that you're dealing with a situation right now. If we do not try and contain it, the potential of the damage that it could do is extraordinary. I mean, if you look at some of those models, just go back to the history. I mean, not models, but history of 1918 pandemic, where you had a virus that happened to be influenza and not coronavirus, that had the characteristics of this virus. A, it was very easily transmissible, namely easy to go from one person to another. And B, it had a high degree of morbidity and mortality. In a population in 1918, where the world's population was 1/3 of what it is now, it killed between 50 and 100 million people. So we don't know, we can't predict what would happen with coronavirus if we let it just run wild with itself and didn't do anything to stop it. Say, well, let's live with it and see what happens. The damage to society globally could be really profound.
But isn't that what you're kind of saying by saying you want to reopen the economy, though? Like, if what you're saying is true, which I'm sure it is, shouldn't we just do a shutdown completely? Don't be in such a rush to open up the economy, whether it's in May, June, we should all sit down for some months?
Yeah, we're not in a rush. And that's one of the reasons why I have been very, very careful. And the input, the decision about what happens with the country is certainly not mine alone. I'm one of a team on a task force that has input into what we do. I have been very, very heavily pushing that safety and welfare of the citizens of this country is paramount. At the same time that people make arguments, okay, we're not going to just open the country, as I said, like a light switch, but we've got to do something because the economy is completely crashing to the point that it may be deleterious effects on health that are indirect. People not being able to get medications, surgeries not being able to be done if you keep the country shut down. I'm sympathetic with that, but my input is geared purely for the public health. So when you look at the final decision, how do you balance a potentially catastrophic effect on the country by shutting down versus a potentially catastrophic effect if you just, let things open. You got to do a balance. And the balance that we put forth yesterday was in those areas of the country where there really is very little that's going on, tiptoe into it and don't necessarily shut down. For places like New York, Detroit, New Orleans, that really got hit hard, you got to pass certain criteria before you start opening up. I think that's a prudent balance that balances the protection of the country with the need to at least start tiptoeing into opening.